Good morning. It is an early casual day. I have been talking about diabetes reversal for some years now and lately been posting about it in the form of a few short videos. Basically, diabetes, it is known as a metabolic condition and it is a different response from your body compared to what is otherwise seen in people who are not diabetic, which means it is broadly a change in the way the body behaves, and that is why it is a lifestyle. So, anything that is a lifestyle can be changed. If it can be changed, definitely you can return back, and hence diabetes reversal. Now, in some conditions it is wholly possible, in some it is partial. That depends on how well do you change your lifestyle, how well do you adapt to it. Also, it depends on your other medical conditions and the state of insulin levels within your blood. But given all these conditions, if you follow a lifestyle that is rigid, a lifestyle that helps you, you can definitely reverse diabetes along with reversing the associated complications of it, like fatty liver, like CKD, and like hypothyroidism. This does not mean that these conditions will arise only if you are diabetic. It can be a reverse order also. You may be a hypothyroid patient and may develop diabetes. You may be a fatty liver patient and you may develop diabetes. You may be a patient of some kidney disease which may translate you into diabetes in future. Any of these disease happening before or after only signify further that diabetes is a lifestyle condition brought about by changes in the homeostatic environment of the body. And that is where all my experience of almost 20 years, and across 20 years, the way I have gone about talking and discussing Prakriti, Ayurveda stands better than any system because it diligently deals with, discusses, and talks about Prakriti. If you do not talk about Prakriti, if you do not have the right assessment of Prakriti, if you do not understand the dynamic variability of Prakriti across parameters, and you do not understand the mathematical, statistical variations to it, which is why it has a variable presentation across races and geography, and yet it can be applied universally. And that is why it assumes a proportion of being a mathematical constant and yet a mathematical variable, or you can say a mathematical variable and yet a constant to be relied upon. It is one of those very unique aspects where medical science actually is interpreted way beyond just the human body, and that interpretation lends the idea that an understanding of Prakriti is very, very critical. Coming back to diabetes, if it was just a Prakriti modulation, as I said. If it was just a lifestyle change as it is supposed to be, as I said, then you, in your journey, can make the change. It is about the right behavior, the right approach, right information, and the right companion who takes you on that path, on that road to diabetes reversal. Thank you.